Welcome back to Morning Joe. Here with us now, Democratic Senator from Indiana and member of the Senate Banking Committee, Senator Evan Bayh. Senator, good to see you again, sir.
Good to see you, Mika. How are you?
We're good. We have been talking about Gidget, but also the president's, Carlos Watson is here with us as well. We've been talking about the president's...
Carlos will talk about anything.
Yes, he will.
You know what, if Evan Bayh's on, I'm happy to talk about just about anything.
The president's press conference on health care last night, did he do anything to convince the public, but also Democrats who have some fiscal concerns about the plan, including you, that we should move forward and hurry with health care reform?
Well, Mika, there's universal agreement that the system needs to be improved and changed. And so the president continuing to advocate for that, putting this squarely at the front of the agenda, helps very much. He continues to lay out the broad goals that we need to achieve, but of course the devil is in the details, and we're now starting to get into some of those details, one of which is how do we afford this, because frankly the country is going broke. It's not something we like to recognize, but it's true. Think about this one fact. 50 cents out of every tax dollar that the federal government will spend this year, half is borrowed. Now, that goes down in future years, but it's still more than we can afford. So we've got to do something about this. So the president expressing his desire to what they call bend that cost curve, to get costs under control, to help the cost for average people as well as to the federal deficit to get that down, that's very helpful. The difficulty is how exactly do you accomplish that? And when the OMB came out last week and indicated that the current plans that have been put forward, in fact, did not do that, it shows that there's still some work to be done.
And of course, there are a lot of people, and I'm sure a lot more than 50% in Indiana that have some serious questions, Mike Barnacle. We just showed the president upside down on health care approval ratings. He's got to turn those numbers around.
And he's got a tough job, and last night was part of the process of trying to turn those numbers around. Senator, let's play a pretend game here. We're in Gary, Indiana. You're addressing a town hall meeting, and I stand up. I'm from Gary, Indiana, a town decimated over the many, many years by the economy. And I ask you the following question. I say, I heard the President of the United States, he's a Democrat, Senator, you're a Democrat, tell me that this health plan is going to cut costs in the future and expand care in the future. I don't know much about the economy, but how do we do that? How do we cut costs at the same time as we expand care?
Well, that's an excellent question, Mike, and I'm not sure that we finally answered that. And it is, I think, appropriate to have some skepticism about the federal government saying, well, look, we're going to spend money today, but trust us, it's going to save you money tomorrow. There are about 18 different things, however, that have been recommended to accomplish exactly what you've laid out in that hypothetical question. 16 of them have been included in these proposals. The problem is that many of them are very small pilot projects. They're not really up to scale, so they don't really save you much money over the next 10 years. And if we don't come to grips with this deficit over the next 10 years, it's really going to get away from us. So changing the fundamental way about how health care is provided to ensure that we get the quality that you need. You can choose your physician, you can get the innovation, new therapies and cures, but doing it more efficiently, that really is the key. The final two things, Mike, so there are 16 of the 18 things. I won't go through the whole laundry list. They're in there, but we need to do more of that. The final two things, and you were discussing this earlier this morning on the program, a commission to take the politics out of how much we pay for these different things. That would be very helpful because Congress always caves at the end of the day in making tough decisions about spending. So having that commission,
and what's the second thing?
And the president's for that. I think you'll find some bipartisan agreement for that. The second thing, Joe, is, as you know, it's ironic. One of the things we're trying to do is to reduce the increase in health care expenditures at the same time our tax code actually incents more health care expenditures.
Right.
So finding some way to grandfather in people who bargain for those benefits to make sure we don't pull them away from them, but in the future going forward to level the field so that we don't actually artificially encourage more health care spending, that would really help to control costs.
We've got a lot to do in a little time here, Senator, but let me ask you also, if you're at a town hall
meeting... Now,
can
I say one other thing, Joe?
Sure.
To that hypothetical person in Gary, I don't know if they would relate to what I've just said. That's kind of wonkish, but those are the things we need to do. Basically, change the incentives in the system to guarantee your care, but to do it more efficiently.
Well, let me get you something that somebody, whether in Gary or Indianapolis or wherever you go, will understand, and that is somebody stands up and says, I'm out of work, unemployment in this town is 22%. And I heard Rahm Emanuel just say that the president's stimulus package, quote, rescued the economy. Has the economy been rescued when actually we have 2 million less jobs than this White House was predicting would have just 6 months ago?
Well, I think we avoided a catastrophe. And, you know, there was a time late last year, early this year, when we were very much staring into an economic and fiscal abyss. Ben Bernanke, the Federal Reserve,
has the economy been rescued?
Very aggressive. I think we've avoided the worst, Joe, but we're frankly still in a very difficult economic situation. We can't afford to take our eye off the ball. And most of the stimulus, as you know, has not yet gone into effect. So it's helped, but we still haven't solved the problem.
Do voters in Indiana that you're going to see at the town hall meetings over the break feel like they have been, quote, rescued?
Yeah, and that they're not in a catastrophic situation?
No, not yet. Our unemployment rate in Indiana is, I think, about 10.6%. There was just an estimate yesterday that it's expected to go up to 11.5 or 6% by the middle of next year because, as you know, it's a lagging economic indicator. So we're in this phase now where the statistics may start looking a little bit better, but to that person in Indianapolis or Gary or anywhere else in Middle America, they're not going to feel that things have gotten any better because, frankly, for the majority of them, it's not gotten better yet. So we need to keep our eye on the ball, and that gets back to health care here a little bit.
Right.
Yeah.
We need to do, in the long run, we got to do the things to help change the system, but we got to do it in a way that in the short run doesn't cost more people to be laid off or exacerbates the economic problem we face today.
Carlos Watson's with us. Carlos?
Senator Bayh, you're a former governor, and as you just said, the unemployment situation in Indiana is fairly serious right now, including in places like Elkhart. Are there 2 or 3, even 3 or 4 things that you're beginning to see create meaningful numbers of jobs in Indiana or, frankly, in some of the neighboring states?
Carlos, it's very tough right now. As you know, we're a manufacturing state, and that part of the economy is still very difficult. Some of the life science areas, however, they continue to hire. They continue to do fairly well. That's a part of our future economy. The green energy, there's great potential there. We're having new wind farms go up in Indiana. We make components for those wind turbines. So in some of the new environmental areas, we're starting to see some economic growth. But you know what? We're still losing more jobs than we're creating. That's something we got to change.
But are there any tax breaks or any particular elements of the stimulus program that so far has been particularly effective in your mind in creating a couple hundred or maybe in some cases 1,000 or more jobs?
Well, you mentioned Elkhart, Carlos. There was some tax incentives in there to help purchasers of recreational vehicles, mobile homes, things like that. That's what we make in Elkhart, Indiana, so hopefully that will help to stabilize that part of our manufacturing industry in Indiana.
All right. Senator Bayh, thank you very much.
Thank you, Senator. Always great to see you. Sorry we had to rush you along on a couple of answers, but we have,
so much to get
so many more questions to ask you.
I'll try and be briefer with my answers next time, but in the Senate, as you know, it's
we don't want that, but we do want you back very soon to talk more about health care.